Hi. Look at that smile.
Yes,
How are
girl,
you?
I am here. Uniform ready.
Amazing. I love to see it. That's awesome. Well, congratulations. We're so happy for you.
Thank you so much. You were amazing.
Aw.
NCLEX High Yield is amazing. You know, I'm not getting paid for NCLEX High Yield. I am just being honest and truth. This is not a
Aw.
paid promotion. Listen, it works. I was from podcast in my ear, cooking, driving, whatever. I was doing it. Um, and Nurse Brittany was like, "Let me see your scores." And look, we had so many health mishaps Saturday and Sunday, but she kept staying the course and with me or whatever in my tutoring session. And she was like, "Let me see your scores." And so my scores went up there. You know, I had Archer, but listen, y'all, do not fret. I'm telling you, do not fret. Keep trying. The podcast. Look, you ain't even asking me no questions. I'm just going on and on and on. I'm so excited. Let me stop and
That's
pause.
okay.
Dr. Zeeshan probably
That
said
is,
she crazy.
No,
that is
I mean,
so
hello. That'd be calling the kettle black. Like I am. Hello, look at me. Um, no, so absolutely. I mean, look, you work with Nurse Brittany, used NCLEX High Yield. Clearly, you've made it very clear it's not paid promotion. But just out of curiosity, what attempt was this for you?
This was my third attempt. So I felt Peter when I saw his message there. You know, after that second time, I was down and depressed. I didn't want to do it anymore. I was and that test killed me. And so I was like, okay, I can't give up because I know I am destined to do this. I know I have the heart and the compassion to do this.
Oh
And
yeah.
so I just got in my mind, and I'm not gonna lie to y'all. Listen, I wasn't one of the ones that rigorously said that I did. Okay, so I did the live course, yes. And then I failed off because I work and all of that stuff. But I did the live course. But then I fell off. I started slacking. I didn't do just stay consistent. I'll say that. Then I was like, okay, I got to get back on this horse. I would not lie to you. 30 days consistently listening to that podcast, reviewing those my on demand, because you have
Oh
on
yeah.
demand. If you buy the live course, you have on demand. Look, when I email Nurse Brittany and told her, I'm like, can I use this for RN or whatever? She's like, yeah, you can use it. You just have to pay a little bit of fee, but you can use it, girl, or whatever. So
Yeah.
I was like, I'm using this all the way throughout RN school because it gives you so much content. It helps you understand. And then Nurse Brittany was like, okay, well, I'll tell you what. She was like, you know your content. I can see that. She was like, at first, I felt like you didn't know your content because of your scores on Archer. But because I was like at what, Brittany, like 50 something,
yeah.
50.
Mm-hmm.
So she was like, so I tell you what, you know your content or whatever, but I did mess up on the baby question, but she corrected me on that one. But she was like, so do this. Maybe try doing a U World readiness assessments for $20, right?
Yep.
So at first I was like, I ain't gonna do it or whatever. Then I was like, okay, it's probably about 8 o'clock at that night. And they tell you don't do any questions, but I was like, I just
Oh
had to
no.
know. Yes. So I ain't
You know
telling
I
y'all to
say
do
not to
this,
do
but I'm
it.
saying what I did. Listen.
Yeah,
So I
no.
paid the $20. 8 o'clock at night. My test was 8 o'clock in the morning. So
Oh
I'm
man.
going through that on the U World Readiness or whatever. And like maybe question 60 something, maybe 67, I kind of stopped because I didn't want to get overwhelmed. So I kind of
Right.
stopped. But my score was good. So
Yeah.
I went in, not to say that I went in so confident, but I went in assured. And then Nurse Brittany had just gave me, so much positive feedback or whatever. She was like, you know your content, just breathe and just take your time and answer the questions.
You
Y'all
got
listen,
this.
Yeah,
apply that
absolutely.
axe grab to every question, and you will not
And that's what
fail.
we're
I'm
about to
telling
do
you.
today. That's exactly what we're about to do today is ask Graph. But real quick, while we wrap up here, how many questions were you, real quick, before we wrap up?
I had 119 questions.
119. So again, just to reiterate that we don't have a set amount of questions before you pass or not. So with that said, that's amazing. Look at all the different things that we're hearing from different stories, and I love your vibe. Like it's intoxicating. Everyone in here is just loving it. Storytelling at its finest. So with that said, Nurse Tiffany, congrats. Welcome to the other side.
Congratulations.
Uniform and all. Let's go. We will talk to you soon and keep us posted on what you're doing.
Thank you for sharing with us,
Thank you.
Tiffany.
Good luck to everyone.
Thank
Congrats
you, Nurse
again.
Tiffany.